In science, philosophy, and everyday life, we try to find the simplest explanations for the things that are happening around us. If you go to the living room and there's a kid standing next to a broken vase, and the kid says that an invisible cat broke it, most of us would draw the much simpler explanation that he made that up, and probably he broke the vase. That is because we suppose that the simpler explanation is much more likely to be true. In science, we try to simplify our theoretical models, since simpler theories get more successful at predicting future events, and all of that is in accordance with a philosophical rule of thumb called Occam's razor, which prompts us to always pick simpler hypotheses, meaning the explanation of any phenomenon should make as few assumptions as possible. If you want more background on Occam's razor, feel free to check out my video on it. But today we're going to talk about a very interesting counterweight to the use of Occam's razor in medicine, called Hickam's Dictum. John Hickam was a house staff member in medicine at Grady Memorial Hospital in Atlanta, known for the saying that a man can have as many diseases as he damn well pleases, with which he was answering to the suggestion that in medicine, when diagnosing a given injury, ailment, illness, or disease, a doctor should strive to look for the fewest possible causes that will account for all the symptoms. The principle of Occam's razor guides the medical practitioner to seek explanations which are capable of accounting for all relevant evidence without unnecessary additional assumptions. One would think that the fewer causes are being postulated in the diagnosis, the better it is. But here's the problem. It is often statistically more likely that a patient has several common diseases rather than having a single, more rare disease that explains all of their symptoms. In fact, multiple diseases or illnesses are the rule rather than the exception. So some authors even contend that because of the adherence to Occam's razor, patients are being routinely misdiagnosed by doctors who insist on finding a single underlying cause for multiple symptoms. Let's imagine a patient reporting insomnia, fatigue, blurry vision, headache, indolence, and weight loss. Well, one single explanation for all the symptoms would be that the patient has a brain tumor. However, it's statistically more likely that the patient suffers from the concurrence of two conditions, namely generalized anxiety disorder and depression. It would be useful to keep in mind the American medical slang word zebra, which refers to the act of arriving at an exotic medical diagnosis when a more commonplace explanation is more likely. It's shorthand for the aphorism, when you hear hoofbeats, think of horses, not zebras. In this view, even 5 horses are more likely than 1 zebra, at least if you're not in Africa, I guess. So anyways, what does all of that mean for Occam's razor? Well, philosophically, not much, but understanding this limitation in medical practice can add to our understanding of the rule. First of all, we have to ask ourselves, why do we accept this rule in the first place? What are the justifications for the use of Occam's razor? Well, one of them is a direct result of basic probability theory. By definition, all assumptions introduce possibilities for error of the theory as a whole. So if an assumption does not improve the accuracy of a theory, its only effect is to increase the probability that the overall theory is wrong. So again, imagine a kid breaking a vase, and you explain that by saying that literally an evil demon has possessed him and made him do that. Well, now you're postulating an assumption, the existence of that demon, but you really add nothing to the theory of why the vase broke. If you would explain it with just the kid being clumsy or even looking for some attention, your theory would do the job just fine without being dependent on the existence of some other worldly entities. The explanation that resolved demons is less likely because an additional condition had to be met, meaning there not only had to be this kid and the vase, no, a demon had to be there too. The more conditions have to be met, the less likely the theory will be. That's just basic probability. It does not mean that the demon actually wasn't there.
Run.
It just means that it's an unlikely explanation, especially from the standpoint of our common scientific worldview. It's important to note that not all conditions have the same likelihood of being met. If I hear hoofbeats, I can either postulate one zebra, but even if I would postulate 10 horses, again if I'm not in Africa, the horse theory will be more likely to be true, simply because the condition of there actually being a random zebra on some random road outside of Africa is very unlikely to be met. But why is that? Why are some conditions less likely to be met than other ones? Well, if we look at the zebra, we see that this is just a shorthand for many conditions that had to be met in order for the zebra to actually be there. This consists of the zebra having to be captured, transported to the local zoo, then it had to escape through a complex arrangement of conditions, such as the zookeeper had to fall asleep and the door of the cage was left open and the main entrance was open, and then the zebra had to travel exactly to your destination and so on. Much more conditions had to be met for there to be a zebra when you hear hoofbeats. It might seem like it's just one assumption, but once we actually take the assumption apart, we logically analyze it, so to speak, we see that it's just a shorthand for many underlying assumptions. And the same goes for rare diseases. Many conditions have to be met for a rare disease to occur. Usually it presents quite a complex deviation from the average human organism. On the other hand, a concurrence of many common diseases can be explained with fewer underlying conditions. It does not present a complex deviation. So, until we take Occam's razor at face value, it might seem like there's a need for a counterweight such as Hickam's Dictum. And once we can understand Occam's razor properly, limitations become obsolete.